Thank you very much. Very glad to be here. Nice to see such a healthy turnout. Just to emphasize that whole cell phone thing, the first person's cell phone that does go off, I usually make a point of running over and sitting in on the conversation. So if you don't want that to be you, you should definitely make sure it's quiet. Alrighty, so today we're going to be focusing on understanding children. I'm told that most of you work with kids in the age ranges of about 0 to 12, so that's where we're going to focus most of our attention. So the objectives for today, what we're going to be doing is essentially providing you a framework for understanding normal children's behavior. After we go over that, I'm going to explain and give you an idea of what happens in children's brains when you start seeing symptoms that get labeled as psychiatric disorders, including OCD, ADHD, anxiety disorders, and so on, so that you can have a better feel for what is a problem, what is pathological, when do we need to identify these children and bring them to medical attention or move it up the ladder to get them some help. In that conversation, I'm going to discuss the very important concept of symptoms versus syndromes. By syndromes, I mean diagnoses. Symptoms are an aspect of a diagnosis, but they do not equate to a diagnosis. And we'll discuss that as we go. So to start with, we're going to talk about normal, because at the end of the day, that's really what the question is all about, is what is normal? What is abnormal? Normal is a mathematical concept. It is any aspect of measurement that is beyond 2 standard deviations from the norm. Everybody understands the idea of normal, but how do you apply normal to something that you can't inherently measure? Something like behavior, something like a mood, how you feel. How do you apply a concept and state that something is normal or abnormal? At the end of the day, normal is not certain things. It certainly is not just what people think it should be. It is not the same as you or people around you. You may hope that's the case, but that does not mean it's the case. It is not the same as something that was always there. Something that's always been there may have been abnormal right from day one. And it is certainly not something that is defined simply by virtue of the fact of does it cause issues for you. It could be perfectly normal and still be frustrating as all heck. All right, so how does a normal brain work? A normal brain functions in a very, very particular way based on very simple principles. And the answer to the question of why is this happening? Why is this child acting this way? Is a very simple one to answer. At the end of the day, there are really only 2 parts of our brain that dictate what we do, that force us to act the way that we act. And it doesn't matter whether we're kids, whether we're adults, whether we're geriatric, we all function at the same level in the same way. Now, these 2 drives, these 2 forces that control our behavior are individual neural networks that have jobs to do, very specific jobs. And these jobs are, on the one hand, the harm avoidance drive, and on the other hand, the pleasure-seeking drive. Now, the best way to think about these 2 drives is to think of them kind of like 2 voices, 2 people that are in your head that are giving you instructions, telling you what to do, and then making you do it. You guys remember back in the old day, you'd watch a cartoon and there'd be little Billy standing by the windowsill and Grandma would put out a pie and then little Billy would be looking at it and the little devil would pop up on his shoulder and go, eat the pie. And then the little angel would pop up and go, Billy, don't you do that. Grandma said don't touch a pie. And then the little angel and the devil would have fights. It's kind of like that, except not quite, because in the cartoons, the little angel and little devil symbolized right and wrong, good and bad choices. In our brains, there is no right or wrong. There is no good or bad. There are simply jobs, tasks to be completed. And in our brains, the only good thing is I did my job. And the only bad thing is I failed to do my job. Now, to make it very clear, I've given these 2 guys names and faces. Because I deal with a lot of kids, it certainly makes it much simpler to conceptualize. I call them Jim and Bob. And Jim and Bob play us like a puppet on a string every day of our lives. So the first guy we're going to talk about is Bob. Bob is the harm avoidance drive, that neural network that exists in our brains for one purpose alone, and that is to make sure that we stay away from danger, that we stay away from the stuff that is going to hurt us. And the way that he works is by constantly monitoring the environment using the 5 senses of the body. So everything that we see, hear, taste, smell, touch, feel gets processed and filtered through this recognition unit. And Bob's flipping through all this information looking for bad stuff. And if Bob sees something bad that happens to come across his page, what Bob does is he takes over control of our behavior and he makes us react in a particular way. And that particular way is whatever he thinks is going to help us stay away from that bad stuff and avoid that danger. To give you an example of what this would look like in an average, everyday adult, you and I, normal people, educated people, not even kids, something kind of like that. That was Bob. Everybody went, cringed, moved, was Bob. That was our body's immediate reaction to a sight of something that is dangerous, something that we think is bad. For those of you who actually have something like arachnophobia, if it wasn't just a picture, if you were sitting there and suddenly a big old hairy spider twirled down its web and landed right there, your reaction would be even more intense. It'd be something along the lines of, you'd jump back, scream, freak out, do the crazy doggy paddle in the air. And the thing that's important to understand about that reaction is that right at that point in time, even us as adults, things that are normally under our control, our bodies, our voices, stopped being under our control. Because we never, at any point in time, chose to do that. We just did. Automatically, instinctively. It was a mental reflex that kicked in at the visual recognition of danger. And it goes even a little bit beyond that, because not only did we not choose to do that, but even if we wanted to choose to not do that, we couldn't. If we had arachnophobia, but we were still intelligent, and we knew it was a harmless house spider, it's a daddy long legs for crying out loud, it cannot hurt you. Nobody in the history of mankind has ever been hurt by a daddy long legs. Ever. They're not even spiders. They're insects. But despite knowing all of that, we would not be able to choose to walk up to it, extend our hand, let it crawl into our hand. And if you look around you, you'll see people sitting there going, "Are you kidding?" And that's just at the thought of doing it. And their body reacts. But that is how powerful Bob is in our lives. When Bob tells you to jump, you jump. When he tells you to move, you move. We don't have a choice whether or not we listen to Bob, even as adults, let alone children. Now, the thing about the activation of Bob that's important to understand is that Bob's whole purpose for being is to protect you from these dangers. So his most important task is get you out of there now. Therefore, he works by activating a response very quickly, very powerfully. But he cannot sustain that response over an extended period of time. His tune does have an expiry time. And for most kids, most adults, depending on the brain, that's about 45 minutes, give or take 15 minutes. It really depends on the brain's biological breakdown of the neurotransmission or the neurotransmitters associated with a panic attack. Don't you love that picture? The next part of the brain that controls human behavior is the pleasure-seeking drive. This is the guy I called Jim. And Jim's job, the reason he's part of our brains, is it's Jim's job to make sure that we go and get the stuff that we want and like, the stuff that we need to survive with. That very fundamental thing like food, water, warmth, physical contact. Things that if we don't get these things, quite literally, we are going to cease to exist as an individual and as an organism. And you guys all know what those things are. Purses, electronics, ice cream, things that you cannot do without, shoes, iPods. And I say that sort of in jest, but not really, because everybody out here is going, dang, good point. Because unfortunately, as far as our brains are concerned, there's only one neural network for identifying something I like, and that's Jim. So it doesn't matter what it is out there that I like. If I like it, it's because Jim has activated in my brain. And in Jim's view, anything I like is good, because it's all about this neurochemical called dopamine. And the way that we determine how much we like something is how much dopamine did it release in our brains. When we experience this thing, how good was it? Jim's job is to monitor internal dopamine levels. It's our fuel gauge. And when that starts to get low, progressively and more attentively, monitors the environment, same as Bob, using our 5 sensory inputs, looking for good stuff, looking for stuff that I want, stuff that I like. And when he sees something that comes across his desk of something I like, what he does is, once again, starts pulling on our strings, jumps in the control seat of our body, takes over control of our behavior, and starts making us do whatever he thinks we need to do to go get that good thing, whatever it takes. To give you an example of what this looks like in, again, us, average, everyday, functional adults. This guy is the reason why you went back for a second sweet out there, when you sat there and went, I really shouldn't, but they're so good. It's the reason why you can't stop at just one chip, one piece of cake, one cookie. He's the reason why people can't quit smoking. The reason why people need to have the last word in an argument and cannot lose, need to win. And even though they know it's stupid, they just keep doing it anyways. When Jim drives behaviors, again, whether we like it or not, we have to listen to him. We have to do what he says. We don't get a choice as adults to say, nah, that's all right, I don't need to smoke, I'm done. It's not that easy. Now, there's a couple of things that are important to understand about the way that Jim identifies things and basically how to get his attention. In order for Jim to notice something, it has to meet certain core criteria. The first one of these is it has to be something that he likes. It has to be something that is associated with dopamine in his brain. If he doesn't know if it gives dopamine or not, he may or may not notice it, irrelevant. But it has to be something that he has experienced in the past, that he knows that he likes, and it has to be real. It has to be right here, right now, right in front of me. It has to be something that he can experience with his 5 senses. It is not the same thing to use something like the word Smarties as it is to walk over and show it. This is real. This Jim notices. The word, maybe, maybe not. It has to be something that is going to be soon. It has to be something that is attainable within a certain time period. Because remember, this neural network is about energy acquisition and conservation. As human beings, we burn through calories just existing. Every minute of every day that goes by, we use up energy. So if something is too far down the road, but is the payoff energy-wise, it doesn't matter to our brains because we need the energy today. We need it now. So the more immediate the gratification, the more immediate he's going to get that payoff of dopamine, the more relevant and the easier he's going to notice it. Third thing to understand about Jim is he is very single-minded. He locks onto a source of dopamine like a little homing missile, and he stays locked onto that source of dopamine until he gets it. Or until a better source of dopamine comes along, in which case he shifts focus and could care less about that one now, and he's over here now. Better source of dopamine just means more net dopamine in the brain, based on experience. And the most variable factor that we can control, based on immediacy of activation. So if I get that in 5 minutes, that's worth a lot more to me than if I get that in 3 hours, or than if I get that tomorrow, or at the end of the week. The more immediate it is, the higher the net value because I haven't had to wait and waste so much net energy getting it. The next thing to understand about Jim, and this one isn't quite as intuitive, but it's extremely important to understand. This part of our brain is designed to make us go get stuff. It cares about what it doesn't have. It does not care about what it has. For those of you with a dog, who've ever played fetch with a dog, this is what the game of fetch is all about. Going and getting the stick. It really doesn't care about the stick in and of itself. It likes chasing the stick. And if you stop throwing it and taking it away from them, they don't care about it anymore. As far as our brain is concerned, ownership of something doesn't depend on who paid for it, who has the pink slip for it, who has the warranty information, or who signed the contract. It depends only on whose hands was it in last. If it was last in my hands, it's mine. This is why kids will sit there and have a toy sit on a shelf, untouched for years. And then the little cousin comes along and takes the toy. And then they go, oh, my toy, I want that! And every parent goes, you haven't touched it in years. How could you possibly want it? You don't want it. Oh, no, they do. They want it now because now it's not theirs anymore. 5 minutes ago when it was theirs, they could care less about it. Didn't matter to them. You could threaten to take it away. It wouldn't have mattered to them. Once it's gone, once it's in someone else's hands, now it matters. Threats are not reality. And these parts of the brain only base their decisions on reality. What do they see, hear, taste, smell, touch, feel? So unless it's actually gone, irrelevant. The last thing to understand about Jim is that Jim is the single most powerful drive in our brains and has override capacity over everything else. And what that means is that if there happens to be a battle between Jim and Bob, both of them chiming in about the same thing, Jim's going to win. Every time. Just ask anybody who smokes. Everybody knows it's not good. Everybody knows it's not healthy. Everybody knows the dangers associated with it, the costs associated with it, the negative smell and everything, but it doesn't matter. Because when Jim wants what he wants, he shuts Bob down. He turns Bob off so he can go get what he wants now. And once he's got it and he's good and he's satisfied and that dopamine level or the need kind of decreases because the gauge gets full, then that's when Bob pops up and goes, oh my God, we're going to die. But while he's going and getting his thing, he's not thinking, oh my God, I'm going to die. That's not the thought. That thought is, oh, I love this. Yeah, it's good stuff. Now, the triangle of control of human behavior, as all of you know, triangles have 3 points. Those 3 points in children aren't 3, it's 2. In children, it is a teeter-totter of control. And that teeter-totter is simply the balance of the volume of Jim and Bob in their brains based on what's going on right here, right now, right this second in my environment. What do I see, hear, taste, smell, touch, feel? Is there more activation of Jim or is there more activation of Bob? And depending on which one is more activated, that's going to dictate what I do. And that is it. There is nothing else that goes into what a child does other than these two neural circuits. Now, Jim and Bob, I talk about them as though they are people for a couple of reasons. Number one, it's important to understand that they are not us. They are not who we are. They are a function of our body. They are a mental reflex that are hardwired into our brains. But we have no control over them. We cannot tell them what to do. They are independent of us. And I use that us concept because the third part of the brain that plays a role in behavior in adults, but not in children, is the thinking part of the brain, the logic and reason center of the brain. Children's brains are not just miniature versions of adults' brains. They are qualitatively different. Children think differently than we do. Jim and Bob are experienced by children in various ways, and by us in various ways. Sometimes kids will tell you that their brains told them to do it, or they had something in their heads that told them to do it, which often concerns people, and they get worried about that. But what the child is basically saying is, it wasn't me. I didn't want to do this, but they did it. The way that Jim and Bob express themselves, the way that we experience their effects on us, are two ways. The first one is they put thoughts in our brains. They make us think something. And we don't control our thoughts. Everybody knows that. Everybody understands that sometimes thoughts pop into your head and you're sitting there going, where the hell did that come from? I do not think that, you crazy person. And we make judgments about these weird things that pop into our heads as though it meant something about us. And sometimes we do the same with the children, and we're like, why would you think that? What is wrong with you? But they just put thoughts into their heads. And then, if those thoughts aren't enough to make you react and respond the way they want you to, what they turn into is what we call feelings. This, Jim and Bob, is what feelings are. Every emotion that we experience, every feeling that we have, is just our experience of different levels of volume of activation of Jim and Bob in our brains. Every feeling that we have is tied to some type of behavior that it is wanting us to do, something that it is trying to exert control over. And the feeling comes before the behavior and usually makes the behavior continue. But the behavior is usually the problem that we all deal with. Sometimes it's the feeling, but it's the expression of that feeling. It's what we see them doing that tells us that there's a problem. Very important to understand that feelings and thoughts are absolutely disconnected and have no care in the world about the relevance of logic and reason. Our feelings don't care if they make sense. As adults, we often make the single biggest mistake when dealing with kids, which is we go up to them and they've done something like gone and whacked their sister, and we go up to them and we look at them and go, "Why'd you do that?" What do you mean, why? What makes you think there was a reason behind anything that I did or said? And kids will tell you, "I don't know." And then you look at them and you go, "How can you not know? You're the one that did it." But kids have no idea what you mean by the term why. Why is an adult concept. It means, what was the reasoning that went into this decision? It was never a decision they made. It was just an action. They just did it. They don't know why. They don't even know what that word means. But they realize after a while it's a fun game that you guys like to play. So then they'll turn it around and you go, okay, but why? And then you'll answer them and they'll go, yeah, but why? And then you'll answer them again and thinking, boy, they're really inquisitive. And they go, yeah, but why? Don't you get it? They're doing the same thing you're doing to them, except in reverse. You know, when you're sitting going, why? I don't know, because I felt like it. That's not good enough. Better be another reason. Tell me why. I don't know. Kids don't know why. It is an exercise in frustration on your part to even bother asking them why. I mean, if you really want to, you can ask them once, but don't go beyond that. It's just frustrating. And the problem also becomes kids can learn. And they can learn that, hey, there's a reason you're asking me this. You haven't implemented a negative consequence yet. So that must mean there's a right answer to this question that could get me out of trouble. So I better come up with it, figure it out. Sometimes parents or caregivers give them the answers. Why did you hit her? I don't know. Well, was she hitting you first? No. Was she calling you names? No. Was she bullying you? No. So why'd you hit her? I don't know. But tomorrow, when you ask why, she hit me first. No, she didn't. I was standing right here watching you. Well, she was bullying me. They don't know what it means. Logic and reason plays a very important role in our lives, but it only turns on in our brains once you hit puberty. Now, whatever age that puberty happens to onset, it's based on the biology of the body. It's not based on any particular age. Average, about 12. Some kids who are very early bloomers will start showing signs of thinking earlier. Some who are late bloomers won't show any signs of that until much later. But you can usually tell because they start asking why legitimately, not just in that whole let's play a game way. But they start trying to understand stuff, or they're thinking now. The other role that logic and reason plays, and the main one that we associate with logic and reason, is it is this part of the brain's job to override Jim and Bob. As adults, we have the ability sometimes to override what our feelings tell us to do. We can, at times, make ourselves do something we really don't feel like doing. But we know we should, so we make ourselves do it anyways. And it's hard. It is hard work, even as an adult, to do that, especially to do that consistently. Just ask anybody on January 15th. So, how are those New Year's resolutions going? Yeah, first day or two, sure, you can make yourself. What about consistently over time? Do the thing you chose to do repeatedly, despite it not being easy. Logic and reason is the part of our brain that allows us to understand the world, understand the big picture. And understanding what that means for kids is important. The lack of logic and reason in children means that they don't get what you mean. They only understand what you've said. Let me give you an example. Let's assume it's wintertime, February, and you're the mom and you're sitting there in the house and you hear some crashing and banging around outside the front door, and you go out there and little Billy's out there with a stick and he's swinging away at the icicles trying to knock them down. And as any concerned mom does, you go over and you go, no, Billy, don't knock the icicles off the front of the house with a stick. They could fall on your head and hurt you. So you go, okay. And you go back in thinking, oh, good. Dang, I saved him. 5 minutes later, out the side of the house, what do you hear? Crashing and bashing. Sounds very familiar. So you go out there, and as most parents do, they'll look at little Billy and go, what are you doing? Now, they're usually confused by this question because they thought it was kind of obvious. So they often go, what? What do you mean? What am I doing? Okay. Either they'll say, I don't know, because they figured out that's the answer to give whenever you question them. Or they'll give you the answer that parents don't like, which is knocking icicles off the side of the house with a stick. What do you think I'm doing? And so then every parent decides to test their memory randomly out of the blue, and they go, what did you have for breakfast? Well, no, that's not really what they say. What they say is, what did I just tell you? but it's the same thing. And he'll maybe remember, maybe not. But if he remembers, he'll go, not to knock icicles off the front of the house with a broomstick. And then the parent goes, exactly! Little Billy's sitting there thinking, what is your problem? This is the side of the house, woman, not the front. You are crazy. What? Well, you just came out here to rant at me because you told me something 10 minutes ago? What's the relevance here? They don't understand what you mean. They don't get it. How many times have you heard, I didn't hit her, I kicked her. Hitting is hands. Kicking is feet. You said don't hit them. So they didn't. They were listening to you. They thought they were doing what you asked them to do. So they really are confused when you're upset because they kicked. They don't get what you mean. When it comes to children and talking to them and explaining the world to them and giving them rules, you either have to be exquisitely specific or you need to be exquisitely general. Take your pick. But you can't give them one and expect that they're going to get to the other. So either you need to tell them something like, do not knock icicles off the front of the house, the side of the house, the back of the house, the eavesdrop, the garage, the neighbor's house, the churchyard, with a stick, a broomstick, a baseball bat, a stone, because that could take forever. Or what you need to tell them is, do not ever touch any icicle anywhere with anything ever. End of story. And leave it at that. And when they go, but what if, and then they ask for the exception, because they're looking for that exception, because they want that exception, because if that exception is given, then that means, haha, that's not a rule. It's just a suggestion. I had a kid in my office, and in my office I always give the children the rules. And I tell them, in my office there is certain rules about playing with toys, about how you play with them, and I said, and the fourth most important rule in my office is you have to listen and do what your parents tell you to do when you're in my office. And this kid looked at me and went, what? I said, you have to listen to your parents. He goes, well, what if they tell me to hit myself? I said, well, then you better hit yourself. What if they tell me to kill you? Well, then you better kill me. I have to listen to them? Yes. Oh, man. Funny thing is, not only did he look at me like, what? So did the parents. They're like, what? Really? Well, here's the simple fact. I know they're not going to tell him to kill me. I know they're not going to tell him to punch himself in the face. I don't need to give that exception as a possible what if. I know the way the world works. That's not going to happen, so it's irrelevant. So I can tell you, yes, if that were ever to happen, absolutely, you do exactly what they say. And then he behaved. But you need to be absolute with kids. Kids do not understand concepts like probability theory. You know, one in whatever chance, or most of the time. Kids understand yes or no, black and white. Is it a rule or is it not? If it's a rule, then it's a rule. If it's not, then it's not. If there's sometimes when it's not, then it's not. And that's the end of it. All righty. Now we're going to get to the concept of the abnormal brain. It is very important to understand and to help parents understand that psychiatrists are the only ones who actually have the necessary training and expertise to make diagnoses, to make psychiatric diagnoses. I went to medical school for over 13 years. Dr. Google has only been part of the landscape for the last 12. Literally 12 years is the existence of Google. Google is not the same thing as a diagnosis. These checklists that parents often go through, or that teachers go through, or that caregivers go through, or that other people look up and tell parents, oh, did you know your child has this? These checklists, these symptom screeners, are not diagnostic. Diagnosis is based on a lot more than just, is this a yes or no and a little tick box in a box. That does not equal the diagnostic label. Now, some physicians, some family doctors, and even some pediatricians don't quite understand that. But that is the reality. It is not just a do you have, yay, this is what you have. Because with psychiatric symptoms, there are many different causes of those psychiatric symptoms. A psychiatric symptom is like saying you have a fever. Well, what does that mean? I don't know. You need to go and figure it out. You need to go to a doctor to find out what is the cause of that fever. Not just say, oh, I have a fever, it must be that I'm feverous and need to have something horrible go on. But that is exactly what happens with these problems. When you deal with normal behavior or abnormal behavior, the degree to which that abnormality is exhibited is important. As psychiatrists, the core criteria that we use when we're looking at something to see is this a problem is fairly straightforward. Does this behavior cause more problems for you on average every day in a continuous way because of that symptom? Does it cause more problems for you than not? If you get into a fight once a week and that fight lasts 10 minutes, and the rest of those 6.5 and 3/4 days are fine, that's not really a problem, even if that one 20-minute episode seemed really outrageous. That's just a blip on a radar. In terms of frequency of behavior, if you charted the frequency of these occurrences, what's the percentage of time that these things happen? If your fever, if your temperature only goes over that mark of 37.5, that diagnostic label, 10% of the time, and the rest of the time it goes back to normal, doctors are going to look at you and go, what's the problem? Go away. This is not really due to anything, because if it was actually due to a problem in the body, it would be like this all the time. It would be like this for hours and hours and hours and continuously. If you have a broken leg, your leg is broken 24 hours a day, 7 days a week, until it heals. It is not just broken Monday to Friday, 9 to 5. That is not a broken leg. That's a different problem. We understand that. And yet, children who have some behavioral problems or issues, Monday to Friday, 9 to 5, never on weekends or evenings or mornings, and yet we go, they have ADHD, there's no question about that, or ODD, or something horrible, because that's what we see. And I'm sure you guys have had that experience where you're talking to the parents, like, what? My kid never does that. What are you talking about? That is not my kid. Or your parents come in and go, oh, this kid is such a nightmare. And you're going, what? This kid is perfect. We've never had an issue with this kid. That is not a psychiatric problem. That is a problem of the environment giving rise to symptoms. But this is that important cutoff to understand: frequency, intensity, impairment, what goes into it. And in every psychiatric diagnosis, beyond the checklists, at the preface to every chapter in the DSM and every diagnostic category that the psychiatrists read but Dr. Google could care less about, is the statement that says this has to cause impairment in every area of functioning in their lives. At home, at school, socially, everywhere. It has to be across the board for it to be considered part of these psychiatric problems. If your brain is broken, it's broken all the time, not just sometimes. So let's talk about some of these things that get broken, if you will. The first situation that I'm going to talk about is what I call Bob blunders. Bob blunders is essentially what people will recognize as anxiety or anxiety disorders. Anxiety is the situation or the problem that occurs when the harm avoidance driver, Bob, is way too loud and way too sensitive for that situation, and we use ourselves as the comparison. We use ourselves as the what is normal in determining that, unfortunately, which is fine. But important to recognize that a lot of these things, especially anxiety problems, this hypersensitivity of Bob. When Bob is hypersensitive, Bob's been hypersensitive since day one. Bob has always been like this. And that's because of genetics, which means mom is hypersensitive and anxious and a worrier too, or dad is, or the brothers and sisters are, their whole family is. And oftentimes parents, when you have this entire environment that has all these very anxious, quiet, shy, inhibited people, they don't recognize it as a problem because they're like, I was like that growing up. And so was my husband, and so are my other kids. That's not an issue. Like, they won't talk to anybody. It kind of is an issue. But they don't see it as such because their environment is normalizing a pathological, potentially pathological behavior. But when we look at Bob's activation, we see situations where either this neural network, where either he's freaking out in general about everything, and it doesn't matter what it is, things bother them, things get on them, irritate them, or it's a very, very specific situation, like a spider phobia, or separation anxiety, or social phobia, or talking to adults, selective mutism, is the biological experience of fear, just to varying degrees. That's the core of Bob. It is very important to understand that these are automatic behaviors. And when talking to parents, for example, as caregivers or as people who see how parents interact with their children, very important to tell parents and to help reinforce that message to them that this isn't a choice that they're making to do this. These kids can't help acting this way. It doesn't help to tell them that today they better not do this and make mom have to leave work to come pick them up because of whatever reason, because it's not like they wanted all this stuff to happen in the first place. But when they get scared, they react. When they get overactivated, when Bob freaks out, it becomes a problem. Anxiety is at its core a perceptual problem. It is a problem with the way that the brain processes information about the world. And that means this. Everybody take a quick look at this picture. All right, what did you see? All those of you who saw a young woman, put up your hand. Oh, come on, look around you. How come not everybody's hand is up? What is wrong with you people? Notice how I say that a couple more hands go up? All of you who saw an old woman, put up your hand. Well, which was it, a young woman or an old woman? Old or young, come on. Discuss it, disagree, and come to an answer, people. Here's the problem. In presentations, I can go back and I can show you both sides of that equation, both sides of that perception, and I'm about to do it right now. If you look at her from top down, you will see the young woman's outline. You will see the eyes, the chin, the profile, the ear, and the hair. If you process it from the bottom up, you see the stubbly old woman's chin, her mouth, her nose, and the eye, and the big shawl. It really depends on which direction did your eyes start looking at the picture in, more than anything else. Now, here's the funny thing about perception. We believe what we see as being correct. As human beings, we never contemplate the possibility that the way we perceive the world is not accurate. We assume that if I saw it, that means that's what it is. But that isn't true. Bunny or duck? Duck or bunny? Come on, people. Are those ears, or is that a beak? And that's the criteria right there. Now, here's the funny thing. If I had told you ahead of time, I'm going to show you a picture of a bunny, everybody in the room would have seen the bunny first. Some people might then have went, oh, but it could actually be something else. But everybody would have seen the bunny. Because our brains filter information based on our expectation and our knowledge base. If I know what something is, I'm going to interpret it in that way ahead of time. And I'm going to see how it fits what I expect. This is important because so often, especially with much younger children, in children who are just coming into daycare, just leaving their mother's sides, when the parent comes up to them and goes, all right, now I know this is going to be hard, and I know this is going to be scary, but don't worry, the teacher's nice, they love you, they're going to be kind, they're going to take care of you, and nothing bad's going to happen to you, okay? Give mommy a big hug, it'll be okay. That kid walks into that school going, oh my God, right off the bat. They have no choice now because that's what they were prepped for. And as caregivers, we do the same thing. If we prep them positively for something, you end up with the same beneficial interpretation as opposed to negative interpretation because of the way the brain works. And that's one of the little tips that you can take back with you is if you tell them what to look forward to in something or change or whatnot, right away, you're going to be tilting the balance in favor of a positive reaction to a situation compared to otherwise. If you tell them, you know what, we're going to have a great day today, Billy, as opposed to going, boy, Billy, I really hope today's not going to be a crappy day like yesterday and you're not going to attack anybody. There's a different outcome. It makes a difference. With anxiety, it isn't just as simple as a perceptual interpretation. It isn't just, I see this sort of one way or the other. It gets to be a little bit more than that. It's kind of like this. Nobody say a thing yet. Everybody put your hands up. Everybody. Whoever can see something in that picture, put your hands down. All right, keep those hands up, keep those hands up. Now I'm going to tell you what it is. It's a boat. If you can see it now that I say it, put your hands down. Those of you who can't, keep your hands up. A boat. Can you see the boat? Can people see the boat in there? All right. Of those of you who still cannot see it, only those people. Can you see what's in here? And unfortunately, we have a predominantly female crowd, which means it's going to be possible that we don't actually get any exemplars here. Do you guys know what this is a test for? Color blindness. How many of you here couldn't see it and know you're colorblind? If you couldn't see any of these, including the boat, you may want to get yourself tested. I say that for a specific reason, because the issue with color blindness is such that with a colorblind person, they have no idea they're colorblind because they can see colors just fine. They know they can see colors just fine. Why? Because they can see about 100 colors. And if you go to Walmart and you get a Crayola pack of crayons that's got 100 colors in it, it pretty much covers the spectrum. Red, yellow, green, blue, orange. So they go, yeah, that bag's blue. Pants are beige, duh. Not stupid. The problem is a normal human eye can see about 1 million. So if you end up having a shade of color that is in between the ones that they can see, what the brain does is it takes that color, and because it cannot understand that color, it turns it into one of the other colors on the other side of it that it can see, whichever's closer to it. And so with colorblind tests, every one of those dots that makes out the outline of that image is in one of those shades that the colorblind people cannot see. And as a result, the dots simply turn into all the other dots, and there is no defining lines to dictate what goes where. And it doesn't matter if you sat there and traced it out for them. You could do that, and they'd go, what are you talking about? It's not a boat. I mean, okay, so you're connecting the dots. I can make it a bunny rabbit. See? Connect the dots. La, la, la. And then you're going, no, it's a... Seriously? But yeah, they cannot see it. And it doesn't matter how you point it out. They will not believe you unless they know they're colorblind in the first place. Because if you're colorblind, then you know you can't see it, and you know you can't trust your own eyes' perception of these things, and so don't bother trying. Anxiety is a perceptual distortion of the world. Kids who have anxiety see the world differently than we do. They experience it differently. They experience it more intensely than we do. Anxiety is at its core a sensory hypersensitivity, a selective sensory hypersensitivity to the negative aspects of the world. And anything that is bad, that is in that area of anxiety, is going to be reacted to as though it were what you're seeing on that side of the screen, which is why the kids' reactions are so intense. I mean, come on, if you had to go get a flu shot and that's what the guy looked like coming into the room, you'd be running and screaming too. And if they approached you with a big old needle on their shoulder, you'd go like, what the hell's wrong with you? Get away from me, buddy. And that's normal, because if it was that bad, of course we'd react that way. But the problem is we're going, it's only this big. It's tiny. They're like, right, I don't believe you. Think of the kids who break down the minute you look at them with anything other than a smile on your face. Burst into tears saying, I'm sorry for everything that they do, apologizing constantly, hoping you're not mad, or asking you, are you upset at me? Are you mad? And you're like, why would I be mad? I'm like, you're mad, I knew it. And then they go away. You're like, I didn't say I was mad, but you didn't say you weren't mad. And you weren't smiling when you said it. You had this quizzical look on your face, which is kind of the same look as I'm angry and upset. So it guarantees that, oh yeah, that's what they saw. That's what they interpreted. Especially in the classroom with the work, pay attention to that board. If you wonder why it is that these kids will seem to be paying attention, but then you put the work in front of them and then they just kind of stare blankly at it and go, I can't. It's like, come on, just try. Why? I can't. It's impossible. Well, yeah, I mean, heck, if your teacher sat there and told you, okay, so today you're going to have to read this astrophysics text and this one here, and in the next 20 minutes. You'd be like, well, I'm not even going to bother to start because it's impossible. But that's how they see it. If things aren't just right, if things aren't ordered, if things aren't the way that they should be, then it is an utter, unmitigated disaster. It is an all or none situation in their brains. The sensory piece. When I say sensory hypersensitivity, I mean hypersensitivity sensorily. In other words, everything that they feel is a lot worse. Their skin is sensitive to the touch. And God only knows who the idiot was who invented bricks of sandpaper at the backs of shirts and decided to stick them in there. But that person was an idiot. And kids can't stand them. And usually parents are like, oh, that's not a big deal. I cut mine out too. I couldn't stand those things since I was a kid. But those tags at backs of shirts, most people never even notice them. Although it has been a boon to have stamps now. Which absolutely, absolutely. It's terrible because then they scratch again. But these are the kids where physically they cannot get comfortable. They do not want their socks on. They do not want their shoes on. They do not want things bunched up. They don't want to put their jacket on and have layers or put a coat on that feels up to here. They won't zip things up or do things like that because it bothers them. Do not make them zip up their jacket all the way. You're going to kill them. Or put their sweater on. How many of you won't wear turtlenecks because you know how it feels? And I know there's some of you in here that are like that because they choke you. Sort of. Once again, nobody's ever been killed by a turtleneck just by wearing it normally. They don't really choke you. Or the kid that, oh my God, I'm dying. That is what anxiety is. Whether it be specific or whether it be generalized, when it's generalized anxiety, the problem is that everything is like that, not just very specific things. And as they get older and they start experiencing more and more of the world and they realize there's so much more bad things out there, the list of things that Bob needs to watch for, needs to compare against, gets bigger and bigger and bigger and bigger and can become exhausting. And right around puberty, along with the development of logic and reason, you develop an awareness of the social world to a degree that was not there before. And you start realizing that people think of you and people judge you. And you start wondering about how people judge you. And then you start seeing social avoidance that goes beyond what it ever was before. Sometimes even in kids that seemed previously confident. They hit 10, 11, 12, and suddenly they don't want to go out. They don't want to go to school. They don't want to participate anymore because they don't know why, even if it used to be something they enjoyed. Typical anxiety-driven behaviors, the ones that certainly from my perspective to early years providers, I would say be on the lookout for, because these are the ones that don't get brought to the doctor's attention too much. Because a lot of them, you think, well, is it really bad to be obsessively neat? To, want to control everything and to write everything down that you need to do and to be such a good, perfect child that never bothers anybody, never causes any problems, gives everything that they have to others, tries to solve the problems of the class, helps out, stays after school, and so on. Is that a bad thing? Isn't that the kid that everybody would love to have? Sort of, except when they hit adolescence and then they hate themselves and then they become miserable and depressed and unhappy because they've never, ever liked anything, and that's why they were always overcompensating. But they end up being high achievers oftentimes, doing really well. So we don't see them. See that are associated with Bob, where after it meets a certain criteria cut off where it's causing problems, and it's happening all the time, so it meets those core criteria. But the labels that are associated with Bob are things like generalized anxiety disorder, specific phobias, OCD. OCD is a slight variation on the theme in that most of the time what Bob tells you to do is don't. Bob is an inhibitory control by and large. Bob shuts you down and stops you from doing something that could be bad. If talking to an adult could be bad, don't talk. If going to school could be bad, don't go to school. If playing with people could be bad, don't go near them. Stay back at the wall. If writing something down could be wrong, could be graded wrong and given an X in school, well, then don't write anything down. Then they can't give you an X. And then it's not wrong. But that's, in general, what Bob does. In OCD, Bob takes a behavioral activation stance for some reason. And there also tends to be a numerical association with it. Numbers are usually very important to kids who have OCD for some reason. We don't know exactly why that's the case, but it is the case, and certainly they've got special numbers, good numbers, bad numbers. They count a lot of things. And the behavioral repetition that gets driven has a repetitive numerical quality to it. Kids who are extremely anxious, controlling, worried about everything, who will wash their hands, worried about germs, won't touch things, but they wash their hands, once. That's more extreme anxiety, but still with a lot of behavioral inhibition as opposed to OCD. OCD, when it comes to treatment, is a much tougher bird to catch, which is why it's kind of got its own separate category. It's kind of like anxiety on steroids. It's really hard to treat and does require professional intervention, and the sooner you get at it, the better, because if these things go on for too long, it can become extremely difficult to try to fix down the road. PTSD is a very specific type of anxiety that is related to a very specific real event in someone's history. And the problem is that it overactivates and stays stuck and doesn't get processed as a past event, but kind of gets processed as a current event and gets replayed over and over as though it were currently occurring. And the problem with that is that if it's currently occurring, the exact same emotion that was occurring at the time of the event is going to reoccur now, even though the event is not happening. And that could be sitting here at a table talking to you, and suddenly my brain replays everything, and I go into a flashback, and I start having this same reaction I had back then, and there's actually nothing going on because it's just my brain that's telling me that it's going on. I'm perceiving it as though it were. And it's different than a memory. A flashback is qualitatively different than a memory. A flashback is like you're reliving it. You're replaying it. You've rewound and replayed the whole thing, and it feels it like right from the start. A memory, you remember it, and then you may feel it depending on how good your memory is and how visual of a person you are. ODD, oppositional defiant disorder. This is a problem with a gym takeover. Now, gym takeovers are a lot of fun. And I'll show you why in this little video.
Wazoo condoms. Fun, sexy, safe.
My daughter went and saw that yesterday for the first time. She's just turned 18. And she was laughing hysterically, and she came up going, "Yeah, that video clip you asked me to go get, I decided to look at it." And then she was laughing hysterically. She goes, "Kudos to the marketing director." But that is what ODD is. ODD isn't per se a problem with Jim. It's actually a problem with Bob, but it's the opposite direction. It's that the harm avoidance drive, Bob's activation to the world, is extremely tiny. It doesn't react to negative stuff, and so there is no behavioral inhibition that occurs. There is no brakes to stopping them from doing whatever it takes to get whatever I want, and it won't matter what I have to do or how extreme I have to get, because I'm not bothered by anybody's reaction to it. I'm not bothered by these things. These are not negatives in my world if Bob doesn't turn on. But the typical things that you see associated with this are that they don't learn from negative consequences. They just keep doing it over and over and over and over. And you're like, haven't you learned? You've fallen off that 5 times. Every time you see going, so stop climbing up it. And you're like, but I want to. Well, and that's the problem. They do want to. And even if right at the moment of pain or something, it's enough to make a tiny, tiny reaction, they still don't learn from it. They don't care if they get punished. Consequences are irrelevant. And not only that, but consequences are negative, sort of. It's you trying to be boss of them, and they will not allow that. So it just tends to make things worse. And then they get mad at you for getting mad at them. And they yell at you for yelling at them. These kids have a constant sense of entitlement. I deserve, I want, and if they have it, I want it. And it doesn't matter who has what, I want it. All the time. They like to be in charge. They like to be boss dog, leader. And unfortunately, with parenting and with child caring, the typical strategies that we have been raised on, we're going to scare kids into listening to us. We're going to make them listen to us because we're going to tell them if you don't. That's how we were all raised. Except back in our day, we could actually have a bad thing happen. We all know what that felt like. But there's a whole different set of rules nowadays, and you're not allowed to beat kids anymore. Oh, I know, some of you, there have been days you would wish that you could, because they're sitting there going, what are you going to do? And you're going, oh, if I had ever done that when I was a kid, you have no idea what would have happened to me. I would have been on death's bed. And they're like, whatever. These kids drive parents and caregivers nuts, because the problem is these are the alpha males of our society. You guys are all familiar with the term alpha, dominance. Alpha is part of the natural genetic heritage of any species that collects in groups. In order for a group to be effective, there has to be a leader. And that leader is established the moment they're born. They're born knowing that they're the boss. If you've ever looked at a litter of puppies, the alpha puppy, you will be able to tell who that is within 3 days. And every other puppy is going to make way for that other one, and that other one's going to get to go nurse first, and everybody's going to stay out of that puppy's way. Because for the first 3 days, it kind of goes like this. Everybody's fighting, clawing. Poor little Bob puppy gets clawed. He goes, oh my God. And that's it. He's out of the race. And everybody else slowly happens, but the one that's sitting there bruised, bleeding, going, I don't care. I'm taking what I want. That's right. That's the boss. That's going to be the leader. But they know, inherently, they know they're supposed to be in charge. The problem is you guys disagree. And they don't get that. Because they know they out-dominate you. They outrank you. And how do they know? Because they met you. Establishment of dominance happens within the first few seconds of any social interaction out there. And I'm going to give you guys a cute little tip and strategy on how to beat this, knowing that that is how it gets established. It got established in one very simple step. They walked in, they took a look at you, and then you said, hi, how are you? And then they said, hi, and then they stared at you. And if you looked away first, you lose. And that's it. And that first time they met you, that eye contact is all it took. And once you've lost, you're done. Because eye contact is our body's innate way of establishing where in that hierarchy you are. It is why we know, even though we don't know how we know, but we know staring at somebody is challenging them. It's a threat. You're begging for a fight if you just sit there and glare at somebody. Doing nothing but making strong eye contact, oh, that's just begging for a fight. And it bothers people. It makes them very uncomfortable. Were you getting uncomfortable? But it's funny because I wasn't even looking at you. I was looking beyond you. But that's my point. You don't actually have to be making eye contact to look like you're making eye contact. Because just looking like you're making eye contact, but not actually making eye contact, helps avoid our natural behavioral response to that eye contact to look away. If every kid you met walking through your doors as childcare providers, when you said hi, your whole goal of meeting them was to see how many pores could you count on the bridge of their nose. And count. Carefully and slowly until they look away, and then you can't count anymore, and then you win. And then you're good. And they will listen to you. They may not like it, but they will listen to you. And they may challenge you later on and try to see if they can reestablish that dominance. But practice it amongst yourselves later on today with a friend. Just go look at them and see where can you look that looks like you're making eye contact without actually making eye contact, that you can hold it there. Because that, for kids, those young kids, single most important thing you can do to keep them in control. In all my years of practice with all the ODD oppositional kids that have walked through my door, I've never had one have an explosion in my office, ever, for any reason. And it's because of that simple trick. And sometimes it takes a while. I had this one kid, oh, she was a challenge. She walked in, she said, hi, 3 minutes. She stared at me, glared at me, got angry, started frowning at me, started opening her eyes. And then eventually she looked away and she was like, and mom's going, what the hell just happened there? Because she was smiling 2 seconds ago. I said nothing, and now she's angry at me and doesn't like me. She was 3 at the time. 3. 2 years later, when she was continuing to have behavioral problems, Mom said, "Do we need to take you back to see Dr. Tom?" She was like, "No, no, I'll behave." And it was better. But it's all about that little tiny trick, which makes a huge difference. When you're dealing with anger, by and large, and you're seeing anger as the problem behavior, anger is Jim's job. 95% of the time, it is related to activation of Jim. And it is because Jim wants something, and something or someone is in between Jim and what he wants. Anger is a power emotion. It is designed to make you stronger so you can smash through whatever's between you and what you want. And the problem is, if that wall is you as a caregiver, well, then you're the one that they go through. If it's another kid, well, that kid's the one they go through. This is a very goal-directed anger, and will continue to keep going until they get what they want. 95% of anger comes from Jim. 5% of anger comes from Bob. Because Bob can, if cornered, and if there is no other possible way to escape the danger, lash out angrily because of the threat. But those kids, it's clear that they're trying to get away. And you're coming at them and keeping coming at them or trying to corner them. And then they are fighting. But if people just back off and leave them alone, they are not going to chase you. They're not going to keep coming after you, unlike the Jim kids. Oh, they'll keep chasing you. Bob kids will be like, whew, thank God, that was close. But it's a very different type of anger. And how you fix it depends on which one's activating it. If you see that it's a child that is scared, that's inhibited, that you know is an anxious child, and suddenly they're angry or lashing out at somebody, guarantee you it's because they think they need to do that to defend themselves. It is not a naturally aggressive act on their part. Now, that doesn't necessarily mean that it's because of a legitimate reason. That misperception of risk, of danger, plays a big role. Because if I see some kid comes along and bumps me while playing a game, to a Bob, that could be this kid just tried to take me out and kill me. So of course I got to lash out and fight back, otherwise I'm dead. Bob isn't the only one that distorts. Jim distorts too. It's just in the other direction. This is why things are so important, that they need it now. And you tell them, not a big deal, guys. And they're like, yeah, it is. But equally, and for the workshop, this is important because it really doesn't matter what it is. If Jim's got his eye on it, you know he values it a lot more than it actually is worth, always. I'm going to talk very quickly about depression. There is a huge difference between feeling depressed and a clinical major depressive disorder, which is what we call a major depressive disorder. Saying someone's depressed is not saying they have a major depressive disorder. That means they're feeling depressed. Feeling depressed is a natural emotional reaction to the world, to an event. If something bad happens or something gets taken away from me or I lose something I like, yeah, I'm not going to be happy about it. It would be weird if I was. So yes, I'm not going to be happy. I'm going to be depressed. But that doesn't mean it's a pathological problem. And I could be depressed every single day, hours on end throughout the day, without it being a pathological problem. The core factor is reactivity of that mood state. If that child, if you go and give them a different environment, a positive one, and you know it's positive, and they are now smiling and laughing and happy and enjoying things, even if for the last hour they were sad and crying and unhappy, and then after that they go back home and then they're sad and crying and unhappy, that's not a depression. That's an environmental influenced thing. When you are clinically depressed, you cannot get happy. It's a problem with Jim being broken. You cannot activate that system, and that's the issue. So, always important to recognize that, because an unhappy kid may just need to be a child where you modify the environment, or at least you work on fixing that child's perception of the environment. You see it a lot in kids with anxiety because of their perceptual distortions, because they believe everything is so bad around them. Of course they react negatively to it. What else could they do? going to touch very quickly on this. Autism spectrum disorders, the other thing that you will sometimes see at your stage, these are problems where Jim and Bob do not react to the social world around them. People do not have any intrinsic positive or negative value to them. In other words, it doesn't matter what you like or don't like or care or whatnot. They have no interest in you. You are a fixture of the environment. You are like a chair. You may have a function to them or not, but they don't care either way. And you see it in all of their behaviors and all of the social behaviors that we expect people to do, to modify their environment based on the social people around them. These kids don't do that under any circumstances. And they don't communicate using really many ways at all. They learn language sometimes, but those nonverbal communication things that we understand, they don't understand them and they don't use them. So even though they may have odd tones of voices, or they may sound like they're irritated all the time, or snarky, they're not snarky or irritated. This is just their tone of voice. This is how their voice sounds all the time. And there's no meaning or intention behind it because you are not relevant. They're never trying to send you any message. You're just kind of like a warning beep that goes off on the fridge saying, door's open, door's open. It's like, oh, fine, I'll go push the button and close the door, but I don't worry about whether the beep's annoyed at me later on or not. It's like, address the issue. You can make a huge difference to how that child's behaving at that point in time, even if you don't have the correlation and the cooperation of parents in their environments, because it's about what's going on right here, right now, today. That's what's going to dictate that behavior. And we're done.